Welcome to all our viewers. I'm Dominica Zetner, an adult cardiologist at the Royal Melbourne Hospital. I run the Cardiac Pregnancy Clinic and I'm one of the cardiologists at both the Adult Congenital and the Cardiac Genetics Clinic. Contraception is an incredibly important consideration for everyone and especially for people with health concerns, including congenital heart disease. Contraception allows us to decide if we want to become a parent and when we want to become a parent. And using contraception to have a planned pregnancy creates the opportunity to make sure that you're as well as possible. What contraception you and your sexual partner choose should be guided by conversations you have with your doctor. It's important to know what feels comfortable, what works for you. Some people have side effects. Are there health reasons that prevent you from using some options? If you're planning pregnancy, then the anticipated time frame might be important if you're considering long-acting contraceptive agents, but do know that they can be removed at any time. The only contraception that provides STI protection is the condom, but the condom has a low rate of efficacy, so I would recommend using that as well as reliable contraception. In general, current understanding suggests that a proportion of congenital heart disease is influenced by genetics. It often involves a combination of genetic and other factors. In the small number of people where a single gene change is identified, the possibility of using this in reproductive decision-making exists, as people may elect to not pass that on to future generations. As we're all made up from half of our mum's genes and half of our dad's genes, either parent may have a gene change that they pass on that results in congenital heart disease. Your doctor or cardiologist can refer you for genetic counselling and assessment for genetic testing. Pregnancy is a little like engaging in significant exercise for a very prolonged period of time. In pregnancy, we see changes in all women's cardiovascular system. If a woman has congenital heart disease, then her heart may not work as well as it should. And if her heart has difficulties in keeping up with the increased workload, there can be repercussions for the developing baby, such as the baby growing less well and being born earlier. So having a planned pregnancy is super important for many reasons, but most importantly, the well-being of the woman and the future baby. So your first step is speaking to your cardiologist to understand potential risks. All women with congenital heart disease should have preconception counselling with a cardiologist, ideally one with congenital heart disease training. This might mean extra tests, occasionally an intervention or operation, seeing other specialists or changing medications. It also allows you to know what your care is likely to look like, where it will be, and the potential issues for you and the future baby. Things to consider are your diagnosis, operations, any ongoing issues, any complications you've had, how well you are physically. Being active is really important. Your medications, other health diagnoses you may have, who else you might need to see, and who might need to make up your care team. Occasionally, there might be serious concerns about the safety of pregnancy for the future mother, and being able to understand those reasons and to know the risks is very important for informed decision making. Some of the most important things that women can do in preparation for pregnancy is to exercise regularly, be a healthy weight, not smoke. You should take folate for at least a month before conception and the first 3 months of pregnancy, and make sure that your immunisations and all your other health checks are up to date. I think one of the most important things to accept is that for most women with congenital heart disease, your pregnancy journey will be really different to those of everyone else around you. At a minimum, you will have more appointments, echocardiograms, a special scan of the baby's heart, a fetal echocardiogram, and a cardiologist pitching in with an opinion about delivery. So having a flexible approach and a trusted team are really important, because your pregnancy is unlikely to look like whatever you have imagined, and how you come to terms with that and incorporate that into who you are and your whole life experience is really important. If you've had a heart-related complication before, for example an arrhythmia, then it's more likely to occur again in pregnancy. Pregnancy in completely well women can lead to symptoms that are similar to what people with heart disease may have. For example, shortness of breath on exertion or peripheral swelling. Even doctors can struggle to tell if those symptoms reflect a change in your heart or the pregnancy. So don't feel silly if you can't tell them apart. Contact your team, make it their challenge, not your problem. It's good to ask your cardiologist about some red flags. You should never have shortness of breath at rest. stay active, avoid excess weight gain, eat a healthy balanced diet, take pregnancy vitamins, and be aware of your mental health. Be kind, stay connected to friends and family, accept everyone's help. Make sure you go home with contraception, and know that any future pregnancy really means going right back to the start with another preconception counselling conversation. The beauty of pregnancy, furthermore, is that it's not an illness, but a life event, and it's a privilege as a doctor to be invited to be part of that journey with you. It's our role to give advice and to do so in an environment where we can create an opportunity for you to ask questions and understand complexities and risks and be part of decision making. So I would encourage you all to have open conversations with the team that looks after you about whether there's a need to consider genetic testing, what contraception may or may not be suitable, what the risks are as can best be estimated of pregnancy, whether it's likely that you would need an intervention or operation to make it safer, if any medications you are on are contraindicated, and establish whether they're comfortable in providing you with preconception counselling and pregnancy care. And if not, ask to be referred to a colleague. I hope that this has been useful, and I wish you all the best in making your informed decisions around your reproductive health and pregnancy.